Welcome back to the special Ladies Lounge edition on cervical screening. This all-important topic. So now we're going to talk a bit more about, people who are feeling uncomfortable, which is like a general question because I don't know if there's any woman you would ask about how she felt about going for
I'm gonna go.
Say, oh yes, I have to do that. I don't think there's one woman actually.
If she's out there. Yeah.
So please give us tips, suggest stuff we can do to help us, jump up and go for this screening.
No, well, definitely. I think the first thing is always to remember that the people doing the examination are so experienced to doing it, and it's our job to help put you at ease. So if you feel uncomfortable, you're nervous, let them know. Don't sit at home and think, I'm not going to go. Say, right, you know what, I'm here, I'm really anxious about it. And that will then also make them to put some extra things in place to support you. So the things I advise about is, first of all, everyone's always worried about, being exposed, and so I say sometimes you can wear a long skirt just to make it easier, so it's less a bit of a stumbling when you're doing it. So a long skirt or a long jumper, etc. And when you're doing it, we will put a tissue over you to cover yourself. But if you feel that, you say to the doctor or nurse, I'm really anxious about this, then they will just go that extra mile to support you as you're undressing and just make sure that you feel comfortable whilst you're laying there. The other thing is that, when we're all sitting in the room and you're lying there and you're thinking, gosh, what's going to happen? There's lots of different things we can do. So we can put on music and say, right,
that sounds good.
A lot of my patients, they bring in their Spotify and they'll say, they'll put in a song and they'll be.
I've never had that.
Yeah, and they bring it and they just to have that and just to put
relax.
them. And the other thing is that breathing can make such a difference. And so I often say to women, put your hands on your tummy and take deep breaths in and out and do it as loud as you can so you can hear yourself doing it, because then you concentrate on the breathing and not on what's happening as well. So breathing can make a real difference. But then also, the size of the speculum, everyone's discomfort threshold is different. So I will have some women that say, oh, Dr. Vanessa, I'm really anxious. I'm so nervous about it. And then they go into the bed and they didn't even feel when I did it. And there'll be some people that they feel, oh gosh, this feels a bit uncomfortable. So you let the person doing it know. The key thing, and I'd want everyone to know, is that you are in control. So if you want to stop the examination at any time, you say stop.
Okay. And
that is key. But also, if you say it's uncomfortable, then they can say, all right, let's use a smaller speculum.
Yeah, I was going to ask about the size.
Exactly. So it's we always start off with a standard size, generally. But if it's deemed that you're uncomfortable and we need to try again, we'll go into a smaller speculum. Right. So don't feel shy about asking to stop. Don't feel shy about asking to use something different. And also, because putting you in different positions can make a difference. So sometimes putting your hands under your bottom and your thighs lifts your pelvis up a bit. And sometimes it can make it easier to do the examination. So all of these things can be done. But it also requires women to say, actually, I'm concerned, or let me know, or to just feedback during the procedure and not just sit there in fear.
And freeze.
Yeah, exactly. Exactly.
Yeah. And I'm thinking, okay, this is a screening we have every so often, 3 to 5 years, is it?
Yeah, so you screen from age 25 to 64.
Right.
Between 25 and 49, it's every 3 years.
Okay.
Then age 50 to 64, it's every 5 years.
Right.
So it's something that is in our lives.
Yeah, and I was bouncing that off what you were saying before about things you can do.
Yeah.
So if this is something I had 3 years ago, and if I had gone through what worked, can I now ask the specialist? Okay, they used the smaller speculum on me, so please just go ahead, use the small one. Don't even test. and, you know, can you set the stage, as it were?
Exactly. Do you know, one of the things I often find within, when I'm speaking to patients and speaking to community groups, etc., is about how you can have a better experience in healthcare. And often, so many of us, we don't say anything.
Yeah.
So we go in and we sit down and we sit back and think, okay, we can't, the doctor or the nurse, they're the ones that I have to listen to, rather than voicing our needs. But a consultation is the key place where you can voice what you need.
Yes, sir.
So if you've got experience and you're saying, okay, I used a smaller speculum, breathing worked, playing whoever in the background work, let us know so that we can do that. Because for me, I want to make sure that you come every 3 years or every 5 years and you tell your friends, you tell your family, make sure you come, and then you can give them the reassurance as well. Because that's how these things work. You know, word of mouth and sharing experiences is so important.
Right.
Yeah.
Speaking of the timing, 3 to 5 years, can you have a screening outside this speculated 3 to 5 years?
Yeah, so, and that is a really great question. So, first of all, the way you get out of it sometimes is because you've put it off. So you've received the letter and then you haven't gone for it. So the key thing is that if you have forgotten or put back your appointment and you haven't done it, please just go anytime to go and have it done. But also, if when we do the screening and we see that there may be some cells there, abnormal cells, or we see the HPV there, then we may ask to bring you in sooner.
Okay.
And then we'll intervene as we need to. And it may be for a period of time. You'll be seen every year rather than every 3 years. But that is on an individual basis. And that is all because we have seen something on screening and we need to intervene sooner rather than later to minimize the risk of cancer. Yeah. So it's all part of the screening process.
Yeah. So how do we book these appointments?
So we've mentioned the letter a lot. So you're on a register. So routinely you will receive a letter every 3 years as a reminder for your appointment. So if you receive the letter, please go and book it. But as I've said, is sometimes we've forgotten, we've mislaid the letter, or where we know definitely we've put it off and we're thinking, oh gosh, what do we do? Just go and book it. So just say that I'm over 25, I'm due for one, or I've never had one. Doesn't matter what age you are. You know, I've got friends in their 40s who have put off having it, and you know, I've guided them, not pushed them, guided them to go and have it. So at any point, don't let that stop you. You can go to your GP practice and ask, or you can go to a local sexual health service and ask for it as well.
So the sexual health services, I personally thought it was just for sexual health. Maybe I'm even mixing it up. I don't know if cervical health is sexual health, and is it this or is it that, or is it the same thing? I don't know, but I thought it was just for that. Now you're saying we can book.
Exactly, and you're not alone, because it's because the term sexual health limits it.
Yeah,
as you see
so you don't blame me.
So you're not blaming you. So it's interesting, within sexual health, we do sexual health, so related to sexually transmitted infections. We do contraception as well, and then we also do cervical screening. Right. So we've got a whole panel of things. So it's not just infections. Okay. So you'll find so you can go on to www.nhs.uk// cervical screening, and you can look on there. But you can also search in your local borough for your local sexual health services, and then find out how to get an appointment and do it that way as well.
Yeah. Right, so we've learned a lot today. I have learned. Look, let me speak for myself. I've learned a lot today.
That's fantastic.
What I didn't know before. So just to round up, give us last words.
So what I would say is that cervical screening is so important, and it's something that it is for us to have some control over our health. And that's something positive that we can do. Yeah. So I would say that if you receive your letter from your GP, please don't hold off. Go and book your appointment. If you've forgotten, you put it to the back of your mind. I'm hoping our conversation has put it to the front of your mind. Please go and book for your appointment. But the key thing is, if you are nervous or concerned about it, you're not alone. And there's no shame in that. But there are so many things, and the things that we've talked about, that can make it a more positive experience for you. And the key thing is, don't be shy to let your doctor or nurse know that you are concerned, so they can talk things through with you and put you at ease. Also know that you're in control. So if within the examination, if you feel that you're concerned, you're in discomfort, you can ask to say stop and to have a break before it's resumed. Yeah. So you are in control. But the key thing is, this is a cancer that is killing women. And if there is something that we can do to change that, let's do it.
Yeah. Absolutely, absolutely. Thank you, Dr. Vanessa Apea.
Great, no, thank you so much for having me.
It's such a pleasure having you here.
Thank you.
I would say again, because I think we've had you on our show before, and I mean, we can't flog it more than this, can we?
No, exactly.
Well, we have to keep flogging it. Having said that, because we want everybody to really take control of their own lives and their health. So we hope that we've brought a beneficial message your way today. And as usual, we're always here every week. So see you next time on Ladies Lounge. Thank you.
2 women in England die every day from cervical cancer, but it is also one of the most preventable cancers, and cervical screening can help stop it before it starts. I'm joined by some amazing women to have some life-saving conversations. So let's just talk through any questions that you've got.
So is cervical screening a test to see whether you've got cancer?
The cervical screening is not a test for cancer. So within your screening, we test for human papillomavirus, HPV, which is the primary cause of cervical cancer. And this virus can affect some of the cervical cells. Those changes can lead to cancer. But don't be alarmed, as having HPV does not mean you have cervical cancer.
My biggest worry is the pain during the screening.
For most women, it isn't painful, but if it is painful or uncomfortable, the key thing is that you let that healthcare professional know. You've got to remember that you are in control and you can stop the appointment at any time.
So the screening, I know they say once you're like 25, that's when you have to start getting it. But if you're not sexually active up until that point, do you still have to get screened?
Within the NHS, we advise all women aged 25 to 64 to go for cervical screening, regardless of their sexual activity.
I think also I have like a lot of friends that are, and myself, worried about going to the doctor and having to be in such a vulnerable position.
No, of course. And again, completely understandable. It's our responsibility to make you feel at ease. So when you're booking the appointment, if you would prefer a female, do let us know. Remember, cervical screening saves lives. Don't ignore your cervical screening invite. And if you missed your last one, book an appointment with your GP practice now. For further information, please visit nhs.uk/cervical screening.